Good evening, and welcome to the Bon Secours Neuroscience Institute educational series on neuroscience. I'm standing in this evening for Pat Lane. I'm Dr. Stacey Epps. I'm the Executive Medical Director of the Bon Secours Neuroscience Institute, and also very thankfully the Vice President of the Epilepsy Foundation of Virginia. Our topic for this evening is seizures. What are they and how can we treat them? This evening I'm pleased to have with me this great panel of experts to discuss epilepsy and epilepsy treatment and really talk about caring for our epilepsy heroes here in the community. Our first guest is Dr. Armandeep Sangha. Dr. Sangha is the newest member of the Bon Secours Neurology Clinics. He's at our St. Mary's office. And we also have Ms. Carolyn Gray. Ms. Gray is also on the board of directors of the Epilepsy Foundation of Virginia. She works for a company called Cyberonics that provides a novel treatment option for epilepsy. She does a lot of community awareness and education events. And our last guest is Mr. Fernando Cordero. He is the regional director of the Epilepsy Foundation of Virginia, taking care of all of the duties and educational needs and other activities of the foundation here in Richmond. So welcome. Thank you for coming.
Thank you.
So community, again, we hope that this series is helpful to you. We hope that we can provide you some education. If you have questions, write them down, because between 6:30 and 6:45 you can call in, ask questions of our panel, and we look forward to speaking with you. The number to call in is 804-915-5202. So we'll be doing that between 6:30 and 6:45. So as we start the conversation tonight, I think it's important for us to really define what epilepsy is. So the way that I typically, the way I typically define a seizure is an abnormal electrical storm in the brain, or a short circuit. So Dr. Sangha, what's the difference between a seizure and epilepsy?
Sure, that's a very important question, and we need to answer this at the very beginning. Seizure is a abnormal involuntary contractions of your body, which is as a result of abnormal electrical disturbance inside our brains. Like, we know that our brains control our whole body, and the brain does that by means of electrical flow of currents. And different layers of the brain also communicate amongst themselves with electrical flow of currents. We call them circuits. So if that current becomes excessive, it flows down and trickles down into your body, which is manifested on the outside as involuntary twitching. Now, this could be just a seizure or a different term when seizures are recurrent, what we call epilepsy. The seizures, all seizures do not really mean epilepsy, because seizures may have some potential causes or triggers. For example, if someone's blood sugar goes very low, or their electrolytes go off, like your sodium, potassium, and all that, if they go up, that's a triggering factor for the electrical disturbance in the brain, and that causes a seizure. Head trauma causes a seizure. Alcohol abuse or other drugs can cause a seizure. Now, when we do not really have a provoking factor in the person, or the individual tends to have recurrent seizures, that's what we start to call it epilepsy. Recurrent unprovoked seizures is epilepsy.
How many do you have to have? So if I were to fall out right now, God forbid, and have a convulsion, the type of seizure where I stiffen and shake all over, maybe bite my tongue, lose control of my bodily functions, what happens to me? I mean, that's a seizure, but does that mean I have epilepsy? When would you say to me, Dr. Epps, you have epilepsy, you need to go on medication?
Sure. Like you said, I mean, we always look for, after somebody has their first seizure, we always look for the causes, like try to find out why this individual had a seizure. If we don't find anything, we just wait and watch without treating with any medications and stuff. And let's say if you have another seizure, which we can't explain why this happened again, then we would start to call it epilepsy, and we start to think treatment, different treatment options that we have. So 2 seizures or more is when we start to consider treating.
Okay. And are all seizures alike? Because the one I just described is the one I think that most of the community is familiar with, where people they lose awareness, they'll fall to the ground, they'll shake. People will describe foaming at the mouth. I mean, is that what all seizures are like, or can there be different types of seizures?
Seizures can be of different types. The one you described is what most people have seen or heard of. Okay, seizure is person falling down, collapsing, stiffening, and going into a twitching. That's a generalized, or we call it a grand mal type of seizure that involves the loss of consciousness. Now, there are certain types of seizures which do not really involve loss of consciousness. For example, the person may just go off into a blank stare with some brief blinking of the eyes, or they just lose touch with the environment and they can hear people talking, they can continue to do some repetitive tasks such as lip smacking, chewing, stuff, and they just don't remember anything about it. That's a different type of a seizure. We call it partial complex seizures. Some people will just collapse to the floor. We will call them atonic seizures. So there are different types, and sometimes people will be conscious and they will have some abnormal involuntary twitching of their extremity. We call them simple partial seizures. So there are different types, and it's important to differentiate between all these types so we can treat them appropriately.
So the different types of seizures may be treated differently? There may be different options for different types?
There are different options for different types. There are specific medications, there are certain treatment modalities that we can apply in certain seizure types more than the others.
Okay. Great. So now Carolyn, I really appreciate you being here this evening. And I know that you were at the Epilepsy Foundation's Awareness Stroll in Virginia Beach this past weekend.
That's
and a little bird told me that you will probably be speaking this weekend in Fredericksburg.
That's correct.
Okay. Can you tell us a little bit about your involvement with epilepsy and the community, and what your company does and what your company has to offer?
Okay. I'm Carolyn Gray. I'm on the board of directors for the Epilepsy Foundation of Virginia. And the purpose is that I go around to a lot of schools in the community and I educate the nurses regarding epilepsy and how to treat the individuals that come in that have seizures. And also we do a lot of school bus training for the school bus drivers or anyone on the bus that's a caregiver for the patients. And also just going out to the community, doing a lot of outreach programs, going to a lot of group homes where individuals live that have seizures. And also going to the Central Virginia Training Center up in like the Hillsville area, to educate the physicians and also the individuals that live there at the facility about seizures. And I work for a company called Cyberonics, and they're the maker of the vagus nerve stimulator. And the vagus nerve stimulator is a medical device that can be used for individuals that have seizures. So just doing a lot of education for individuals here in the Virginia area that have seizures.
Great, fantastic. And for Fernando, you are the regional director of the Epilepsy Foundation of Virginia here for the Richmond area. What does that encompass? I mean, tell us a little bit about the foundation, what the goals are, what you do, what the foundation does, and how patients with epilepsy and how the community benefits from the foundation.
Thank you, Dr. Epps. The Epilepsy Foundation of Virginia was established in 1978. Mm-hmm. And the mission is to provide awareness and support to those who suffer the disorder. We have a number of programs and services for people with epilepsy. But before I mention all of them, I would like to share with the public that in Virginia, there are approximately 100,000 people with epilepsy.
Wow.
Mm-hmm. 50,000 people, 50,000 are children. And there are many social problems that these people have to face. Based on that reality, we have developed a number of programs to inform, educate, and empower people with epilepsy. We have programs such as support groups statewide. In each city, we have a volunteers that they run support groups. Usually they meet once a month. We have seizure training for school nurses, for school personnel, and for children. For example, to give you a very practical example, in August this year, we trained 540 assistant teachers in Chesterfield County. So practically all the assistant teachers in Chesterfield County were trained about seizures. They learn how to handle a seizure. We also have transportation services for those persons with epilepsy that they cannot have access to a doctor or to a support group. We make arrangements for them to get where they are supposed to go. We have an emergency fund that provide assistance to those clients. We call clients those persons with epilepsy that calls for our services. Those clients that for any reason they don't have enough money to purchase their medication. So we are able to provide 1 month of medication for these people, and we try to find out through other organizations if they can help them beyond 1 month. We have a beautiful program called Use a Helmet, Prevent Epilepsy. It is very popular. Every year, all the 4th graders in the state of Virginia are invited to participate to a drawing contest. They have to produce a drawing with the theme, Use a Helmet, Prevent Epilepsy. Because traumatic brain injury is one of the main causes that can produce post-traumatic epilepsy. So there is this contest. The kids go to a selection panel, and 12 kids will be the winners of that contest. The winners, they will come in January to the General Assembly in Virginia to meet the senators and delegates of their respective counties or districts. And they have to do advocacy with these legislators. One of the products, if I can say, of the context is the production of this calendar that includes the drawings of the 12 winners. It's a beautiful calendar. Then those kids that they have a breakfast with their senators and legislators, they have a tour of the Capitol, and they learn about how to do advocacy with their own legislators. This year, we are very glad because the event will take place at the office of the Lieutenant Governor of Virginia, Dr. Ralph Northam, who is one of our major supports at the General Assembly, jointly with Dr. John O'Bannon. In terms of policy and advocacy, we have been able to build a bipartisan coalition at the General Assembly of Virginia that support our programs and services. And if I'm not mistaken, 6 years ago, the General Assembly passed a joint resolution commending the Epilepsy Foundation of Virginia for its program, Use a Helmet, Prevent Epilepsy. We have volunteers that they will help our clients to find solutions when they face a job problem. Job problem is one of the major issues. Just to give you some figures, 25,000 people with epilepsy in Virginia, they're underemployed, and 30,000 are unemployed. Children with epilepsy, and certainly Dr. Epps and Dr. Sangha will address this issue, they do not finish high school because, among others, they suffer from social isolation. And you can imagine a teenager that has to live with this burden of every day, thinking that eventually he or she can have a seizure. All these programs are run by volunteers. Volunteers, I insist. And our mission is to inform, educate, and empower.
And you brought up a good point there with, excuse me, with inform. I mean, you know, public awareness of epilepsy, I think, is lacking. I understand that the Epilepsy Foundation of Virginia, this coming Sunday, the 9th, right across the street here from the studio at the Bon Secours Washington Redskins Training Center, is holding an awareness event. Tell us a little bit about that and what the purpose of that is.
Sunday is the party, if I could say. We are celebrating the 10th anniversary of the annual Epilepsy Stroll. The Epilepsy Stroll is not a competitive event. Everybody, the public at large, is invited to attend. During that event, people with or without epilepsy, they will have the possibility to exchange experiences and views and ask questions to medical personnel that will be available. That day, we are going to have, in addition to the information aspects of the event, very funny things. For example, entertainment for kids. We are going to have a clown, face painting. We are going to have food, refreshments for free. So everybody is invited. When we started with the stroll 10 years ago, we had 16 people that came. The last few years, we have had a huge crowd that join us. And it's beautiful to see that many people that comes, they don't have someone with epilepsy in their families, but they do understand the issue of the helmet, the issue of taking care of your head, your brain. I remember many years ago a doctor said, you know, in United States, families spend billions of dollars with extracurricular activities, and nobody spent 1 cent to learn and protect our brains. So that will be a day of celebration, and we are going to have our epilepsy heroes that day, and I take the opportunity to invite everybody. And if you need additional information, you can send an email to fcordero@comcast.net, yes, or you can send an email to patricia_lane@bshsi.org.
Fantastic, and thank you for that. And the walk or the stroll is really, I said this the other week, it's really a combination of an educational session and a carnival. As Fernando said, we're going to have lots of activities for families. We're going to have, I'm not going to say any names, and it's Sunday, so active NFL players will be working. However, we have been lucky enough to have a retired NFL player who will be with us at the Redskins Training Center talking about helmet safety. We'll be giving away bicycle helmets for children who need them, stressing helmet education, protecting your head. Moving Mania will be there. And really, from the Bon Secours Neuroscience Institute, we recognize the partnership with the Epilepsy Foundation really is one of coexisting and really meshing missions. You know, our mission to provide good help to those in need is exactly what the Epilepsy Foundation is doing, and we're proud to partner with them and proud to support this. And again, bring your family, bring your neighbors, and come on out. getting back a little bit to epilepsy itself, I'm going to read some statistics about epilepsy. 1 in 26 people will develop epilepsy during their lifetime. 2.5 million Americans have epilepsy, approximately. About 180,000 new cases are diagnosed each year. The onset of epilepsy is the highest at younger ages and at older ages. And it's the 4th most common neurologic disorder, right? So behind migraine, stroke, and Alzheimer's disease, you have epilepsy. And as we said, public understanding of epilepsy is limited. So Dr. Sangha, with all of those statistics, how do you diagnose epilepsy?
Like we mentioned before, we are trying to detect the electrical disturbances in the brain, and one thing we do for that is to do a test called electroencephalogram, or an EEG, which is the capture of the electrical rhythms of your brain. And sometimes we can see an electrical disturbance originating from a part of the brain, or sometimes it will be originating from an entire brain at the same time. So that kind of helps differentiate what different types of seizure disorders this could be. Now, typical routine EEG is a 20-minute long recording, and sometimes we are not able to pick up the electrical disturbances that we're looking for, and we will try to prolong the length of the EEG, sometimes to 1 hour, sometimes even up to 24 hours. Sometimes even that is not adequate. We will bring the patients back into the hospital, and we'll keep them in the hospital in a controlled setting, which we call the epilepsy monitoring unit, where they will stay for 4 or 5 nights. And we will monitor them with the continuous EEG, and we will also have a video going on at the same time, so we can see them when they have a seizure, and at the same time analyze the brain rhythms to see what was going on. And we also will make sure that there is no structural problems with the brain, there is no scar tissue, there is no other mass lesions, and we also take a picture of the brain, usually with a CAT scan or an MRI scan of the brain.
Mm-hmm. So you do these tests, do you always get the answer?
Good question. We don't always get the answer that we're looking for. We sometimes have to go with our clinical judgment that whether we have to consider this epilepsy and we have to be aggressive about the treatment. A majority of the time, all the tests that we do, including the EEGs, are negative or normal. But a negative EEG does not really rule out the possibility that the person or the individual does not have epilepsy. Mm-hmm. So clinical judgment, the clinical history, the presentation, and the test, they all go hand in hand. So it's very important to continue follow-up with an expert who knows and understands epilepsy to see whether a person might need treatment or not.
And that's an important point I think you make, is that it's not a blood test, right? You can't see it on an X-ray. So you really need someone who has advanced training and subspecialization in epilepsy, and like yourself, to really monitor and follow these people. Another question, are women or men more prone to have epilepsy than the other? Or do you see it more in men or more in women, or is it about equal?
I think epilepsy does not discriminate between the two sexes. They are both equally affected.
Mm-hmm.
If you search the literature, some studies will say that actually the prevalence of epilepsy is slightly more in men. But women, it gets more attention because of a lot of other issues that women have to face, especially in regards to the reproductive health and pregnancy, and hormonal fluctuations, especially related to the menstrual cycle, which predisposes them to have more seizures clustered around their cycle. So there are separate issues between men and women, but they're both equally affected.
Okay. So Carolyn, well, before we go to Carolyn, let me ask you this. So when you diagnose epilepsy, how do you first treat it? I mean, is it, you mentioned medications. I mean, is that the mainstay of treatment, is medicines? I mean, are these injections? Are they tablets? How do you treat this? What's the best way to go about it?
Like you said, I mean, there are different ways we can treat epilepsy or seizures, and the mainstay or the first line is the medications. And Majority of the medications, they are all available in the pill form. So we will prescribe, depending upon what type of medication will best suit an individual, we usually prescribe them a medication, and there are several different types available. So that's usually the mainstay, and there are some other modalities as well, which we can talk about, including surgical options. And before the surgical options, there's another device that Carolyn was just mentioning about. It's a pacemaker-like device that we can implant under the skin, just above your collarbone. Keeps sending impulses or electrical signals up to your brain, and it has been successfully shown to reduce the number of seizures in people who have failed 2 or more medications, and it's a good adjunctive treatment for somebody who may not be a candidate for surgery. Surgical options are reserved for those patients who have a clear focus of electrical disturbance in the brain, and there is a clear abnormality that we can see on the pictures, and we work them up like if it is safe to remove that part of the brain, and sometimes surgery successfully treats their epilepsy or cures their epilepsy in rare cases.
So basically for most people, they're going to start off with a medication. If
Correct.
that medication fails, you will change medicine or add a medicine, and then once they're not responding to a medicine, that's when you start thinking about things like surgery or the vagus nerve stimulator?
Correct. Typically, we try one medication, we maximize the dose, the most effective safe dose that we can use. We will start to add on a second medication, and when 2 medications, in rare cases, fortunately, majority of the patients, about 60-65% of the patients, you put them on one medication and they do excellent. Another 15 to 20% will do very well if you add a second medication. Then we're left with another 5 to 10% of the population with epilepsy who continue to have seizures despite having 2 or more medication trials, and that's when we start to think about other treatment options.
Okay. So Carolyn, I have a patient who has tried medicine X, not done well, tried medicine Y, not done well. The evaluation has shown that this patient is not a candidate for surgery. How do I know this patient is a candidate for the device that you work with?
Okay. Well, with the vagus nerve stimulator, it's been FDA approved since 1997. There's over 85,000 individuals that have the vagus nerve stimulator for seizures. The vagus nerve stimulator is indicated for any individual 12 years of age or older who's tried at least 2 to 3 anti-epileptic medications and they're still having breakthrough seizures. It is a surgical procedure. It takes about an hour and a half in the operating room. And this procedure is done here right in the area. If it's a pediatric patient, the procedure is done at the Medical College of Virginia or Virginia Commonwealth University, and the procedure is done by Dr. Ward. And if it's an adult patient, this procedure is done at Bon Secure Hospital. It's done by Dr. Brody Newton, who's a vascular surgeon, and also over at Virginia Commonwealth University with Dr. Catherine Holloway, who's a neurosurgeon. And the surgeon will make a pocket right in the chest area on the left side, and that's where the little generator is placed. And then an incision right in the crease of the neck to expose the vagus nerve. And then the 3 little electrodes at the end of this lead are coiled right around the vagus nerve. So this generator will send an intermittent stimulation to the nerve, which will send a stimulation up into the brain region, which will hopefully abort a seizure, shorten a seizure, or shorten a post-ictal time after a seizure. So the individual has the procedure done, and then 2 weeks later, they'll go in to see their epileptologist or neurologist. And at that time, the neurologist will turn on the generator. And so the way that it works is that every 5 minutes, the individual will receive a 30-second stimulation to the nerve, again, to hopefully abort the seizure, shorten a seizure, or shorten a post-ictal time after a seizure. It's not the silver bullet to say if you get the vagus nerve stimulator that you'll never have a seizure again, but the whole purpose of getting the stimulator is to hopefully, maybe around the 3 to 6 month mark, if you're doing fairly well, that your neurologist or epileptologist will start weaning you off of some of your medications so that you'll have a better quality of life. So again, for those individuals that are not good surgical candidates, vagus nerve stimulator may be a good option.
You mentioned something about shortening a seizure or aborting a seizure.
Yes.
How does that work?
Well, shortening a seizure or aborting a seizure, every individual that have a vagus nerve stimulator also have a little magnet that they carry with them. So some individuals have an aura before their seizure. That's a feeling that they feel before that seizure comes on. So if they have that aura, they can take the magnet, place it over their chest area for 2 seconds, and it will give them an extra stimulation to hopefully break that seizure in its track. So that magnet is extra, but regardless of the fact, the individual is going to receive that 30-second stimulation 24 hours a day, 7 days a week, 365 days a year.
So that really goes into what Fernando was saying a little bit earlier, is that epilepsy is really a disease where patients don't have much control.
Yes.
You know, he used the example of the child in school not knowing when he's going to have a seizure. This gives some patients a sense of control, because if they know a seizure's coming, they might be able to stop it.
Definitely. Definitely. It gives the patients some sense of control over their seizures, or their caregiver, or even in a classroom setting.
Right.
If they're in school, and even if they have a seizure before, if they don't have an aura, they just fall down and have a seizure, you can still take the magnet, place it over their chest area to give them an extra stimulation to hopefully break the seizure or break the post-ictal period that the individual has after the seizure.
What's a post-ictal period?
The post-ictal period is that period after an individual has a seizure and they're just kind of out of it. Because most individuals that have seizures, they'll tell you that it feels like they've been in a fist fight, because all of their muscles are just, just going all over the place. So at the end of a seizure, they're kind of out of it, just want to sleep all day. So it just really tears away their quality of life.
Dr. Sangha, do you recommend patients for this procedure at times? Or is this something you're familiar with that you do in your practice?
Yes, I do. Especially like we said before, that if a individual has failed 2 or more medications, or sometimes the side effect of the medications itself becomes a big concern. They've been switching around medications 3 or 4 times, and then the seizures are continuing, then we definitely start the discussions about the vagal nerve stimulator.
Okay, great. And again, Carolyn, you said it's a fairly simple procedure.
It's a fairly simple, minimally invasive procedure.
Okay.
Again, takes about an hour to an hour and a half in the operating room. And the best part about this procedure is, again, it's not a brain surgery, and it's done on an outpatient basis. So you'll come in, have the procedure done in the morning. If everything goes well, you go to the recovery room, and about an hour or 2 later, you're heading out the door home.
Fantastic. So now I'm going to move to you, Fernando. You used the term epilepsy hero.
Yes.
Tell me, why do you say epilepsy hero?
It is because a person with epilepsy faces so many challenges that a regular human being won't. They have to struggle on many fronts every day. We were talking about the kids at school, the fear of having a seizure. When they finish the day and they go home, they feel good. And we try to convey that message that they're heroes, that they can be like anybody else.
Okay.
If someone is taking care of them, they have a doctor, they are taking the right medication, etc., they can do anything they want. And this is why they're our heroes.
Do you see that, Dr. Sangha? Do you see in your practice that patients with epilepsy can lead normal lives?
Absolutely. They need the proper social support system, their support groups, and they need the education and empowerment, and they need to understand the disease. We can control epilepsy. We can make their lives better. We have patients who have epilepsy and doing excellent, and they have gainful employments. They do all kinds of jobs and lead perfectly normal lives, just like the mainstream.
So that's one of the misconceptions, I think, about people with epilepsy, is you hear people with epilepsy perhaps can't work a regular job, or that we know that they're underemployed or unemployed a lot of times. But Fernando, do you think that's because of their disorder, or do you think that's because of the stigma society places upon people with epilepsy?
The stigma, and I really appreciate your question, because a couple of years ago, we conducted a research that demonstrates that for an employer, for example, who would like to hire someone with epilepsy, it costs $0. There is nothing to change in a working environment. The only thing that is required is that the team where this person will work be trained on how to handle a seizure in case this person has a seizure at the workplace. And many employers think, or they fear, that they are going to have seizure and they won't produce what they were supposed to produce. Another statistic, Dr. Epps. Among people with epilepsy that they have a job, there is less absenteeism than people without any disorder.
So they call out less than people who don't have epilepsy.
Exactly.
Why do you think that is? I mean, I don't know if you know from the study.
Because they are so grateful when they have a job, and they want to keep it, and they want to show that they are good. They are good employees. I mean, 2 years ago I met during the stroll a young woman who is a lawyer, and she has epilepsy. And she told me all the challenges for her to find a job. Obviously, based on the American with Disabilities Act, an employer has no right to ask in a job interview if someone has a disability. They cannot. But they will eventually find ways to avoid that. And we have a very positive message for employers that they can hire people with epilepsy. And we, at the foundation, we will provide the training free for the employers, the boss, how to handle it. But it costs nothing to an employer.
And that's a very good point to make. And if a patient with epilepsy is having difficulty in seeking and finding employment, the foundation is available to assist with that?
Exactly. Okay. We have services that we deal practically on a weekly basis with issues regarding rights for people with disabilities.
Fantastic. And people can get in touch with the Epilepsy Foundation on
the
website.
Exactly. The website
efva.org.
Okay. Exactly. efva.org.
Great. Yeah. Now, when you mentioned training, I'm going to throw this out to any of y'all who want to answer. What do you do when somebody has a seizure? I mean, it can be frightening. It can really scare people, but what do you do? How do you take care of that person who's having a seizure? What's the training like to care for someone who's in the midst of a seizure?
The most important thing that we want to make sure is, like we have been mentioning all along this talk, that the worst complication of a seizure is trauma. So we want to make sure that the person or the individual who is having a seizure is safe. Now, how do we ensure that? People don't know what's happening to them. They are in a violent twitching and convulsion and jerking movements of their extremities. Their bodies are arched, and they might be hitting their head against furniture, or they might be bruising themselves by falling off someplace. So we really want to make sure that there's no pieces of furniture around them. They're not hitting their head against the wall. We should lay them over because, when people are unconscious, they cannot swallow their own secretions, and that may go into their lungs, or they may aspirate. So we just try to roll them over to their side so that any excess secretions that are accumulating in their mouths can just flow out. And typically, a convulsion or a seizure lasts a couple of minutes or 2 or 3 minutes. And then, the person will be very sleepy or tired for the next few minutes when they start to come around. And within a matter of minutes, they will be back to their normal self.
Back in the day, you would hear people say, put a spoon in their mouth, or put your wallet in their mouth. Can people swallow their tongue during a seizure? I mean, what should you do with their mouth?
No, absolutely not. You just cannot swallow your tongue at all. And actually, it's a bad idea to put anything in their mouth, because that might harm them. It's very difficult to open the mouth of a person who is in a convulsion, because it's a very, very tight contraction. And if a person may harm themselves when they're trying to do stuff like that. So just try to make them safe. That's the most important thing. Try not to stuff anything in their mouths.
Right. Now, when would the situation change? I mean, is there a time when a seizure would go on for a certain period of time, or you would have a certain number where you might need to make sure you had 911 on the line or seek emergency help? When would that happen?
Like we just said, a typical seizure will last 2 to 3 minutes, and then the person becomes unresponsive, and sometimes they'll look pale and sometimes they'll look blue for the next couple of minutes, and then slowly they start to come around, and you can arouse them within the next 5 or 7 minutes or so. Now, if a person or an individual has a seizure and it's been more than 5 to 10 minutes and they're not coming around, or they're having another seizure back to back without gaining consciousness in between, then they might be having electrical disturbance going on underneath, which is not manifesting on the outside. And it becomes important for anybody around them to call for help and get them to the hospital so that they could be properly diagnosed and adequately treated if need be.
Great. So, Carolyn, you talked about, and Fernando as well, about education for the community about what to do with the seizure. Now, I know this weekend at the stroll, we're going to do some seizure safety talks. How can a group, I know you've done bus driver training and police officer training and school nurse, how can a group that's interested, a daycare center or a church group, how can they get this training?
Very simple. They contact the foundation and they ask for a training. We will fix a date and we will have nurses who will give the training session.
All right, great. We have our first caller. Hello, caller. Thank you. Welcome.
How you doing? I don't have a question. I just like to make a comment.
Yes.
I really enjoy this show, and I appreciate the people on the panel and you, sir, for taking your time to bring this information to the household and our communities. This is great. Thank you so much.
Oh, thank you. Thanks. Thank you for watching, and if you can help spread the word, that would be great. But yeah, we appreciate that, and this is what we do. So thank you. What is are there rules or regulations about things you can or can't do if you've had a seizure? I mean, what about driving? If I had a seizure tonight, can I drive my car tomorrow?
Actually, no. The Virginia state law, and actually it's pretty much standard across the nation. Some states differ slightly from the others, but once you have a seizure, the Virginia state law recommends that you should not drive for 6 months. And that's for your own safety and for the safety of people around you, because it's the unpredictable part of the seizures that we just do not know when it's going to happen again. And you might be on the highway doing 65 miles an hour and a seizure hits you. You could just imagine what can happen. It will be a disaster. So studies have shown that if you go 6 months without having a seizure, the chances of you have another seizure becomes pretty low. Even the state will let you drive in those situations.
Okay, fantastic. And that can be a big burden.
It is actually one of the worst things that we have to discuss when we see somebody with a seizure, that this is a big restriction. It kind of breaks them up for a little bit, but then we try to discuss the positive sides of it. It's for their own safety and for the safety of people around them. There are ways to get over this. Your family, friends, public transportation, they all come in handy in those situations. And 6 months go by pretty quickly.
Now, I was reading that the Epilepsy Foundation actually has a program that can provide a means for transportation for people.
Yes.
That's not just some short term, but that you actually have maybe I don't want to say a cure, but you have a longer term solution for some people. What is that?
In terms of transportation,
yes.
you mean?
I heard there's a bicycle program or something like that.
We do have a bicycle program that you know very well. Okay, and during the last year's stroll, we collected bicycles from the participants, and they were distributed to people. I mean, bicycle is a good solution. I mean, when you go to Europe, in Denmark, for example, or Holland, everybody rides a bike. Doctors, teachers, students. It's beautiful. And this is something that we are implementing, the foundation, with the support, obviously, from Bon Secours. And if there is a need, once again, just a call or contact the foundation through the website efba.org. And we have a network of regional directors. So it doesn't matter if the call is addressed to a regional director in Virginia Beach when the client is in Richmond, because the regional directors will refer that person to me in that case.
Fantastic.
But we do have that program. Yeah.
Fantastic, and that's and again, it's a good compromise because you're not driving. You know,
Exactly.
certainly you could still have a seizure while you're riding the bike,
Yeah,
but it's a way to allow people to get to work,
exactly.
and that's what we want.
Exactly.
Normalcy.
Yeah.
And speaking of normalcy, what about ladies who have epilepsy? And I'll open this up. There are a lot of issues, and Dr. Sangha, you alluded earlier about women's issues in epilepsy. What are some of the things that are different? I mean, can ladies with epilepsy have families? Can they get pregnant? Are there some special concerns about that? Or do we say, no, you have epilepsy, don't have a baby?
No, ladies with epilepsy can successfully have children, and it has been happening without any problems. We have all seen this in our practices. Actually, treatment becomes more important when you have epilepsy. You know, there are several medications which are fairly safe and can be safely taken throughout the course of the pregnancy. And as a matter of fact, if you don't take your medications, or somebody says don't treat epilepsy during pregnancy, that could be harmful and dangerous and can cause a lot of issues, including miscarriages and all during the pregnancy. So pregnancy and women's issues and hormonal issues can all be effectively dealt with in today's day and age with all the options that we have available.
Is there something that ladies would think about in particular in terms of bone health as ladies age and become postmenopausal, their bones get thin? But I've read studies where they say that even men who are on certain seizure medicines can have some bone issues. I mean, is there a way to screen for that?
Absolutely, yes. There are a few medications which are very effective anti-seizure medications, but then one of the downsides to them is they can start dissolution or resorption of your bones. And we have to monitor them with bone scans, or we also call them DEXA scans, periodically. We also recommend people to take some extra calcium and vitamin D supplements in those situations, and that is something that we could easily deal with and monitor.
Okay. And Carolyn, if a female patient has epilepsy and has a vagus nerve stimulator, is that okay? Do you have to turn it off? I mean, is it okay in pregnancy?
It's okay in pregnancy. Having a vagus nerve stimulator is not like having a medication because it's not going through your systemic blood system, so you're not getting the side effects from the vagus nerve stimulator as you get from medications. The side effects that you may see with the vagus nerve stimulator is that when it stimulates for those 30 seconds, if you're talking, your voice may get a little raspy, you may have like a little voice alteration, or you may cough to clear your throat, or if you're overexerting yourself, you may have a little shortness of breath when a device goes off. But as far as any type of systemic side effects, you're not going to see that with the vagus nerve stimulator.
Well, great. It looks like we are about in the last 9 or so minutes, I think. Is that somewhere around there? So let's take this time to just kind of do a little round table. And Fernando, you can start and just give us some takeaway points. What are things that you want the community to take away from our time together tonight, besides showing up at the Epilepsy Walk on Sunday?
And what time is the walk on Sunday?
It's from 1 to 3, and again, it's at the Bon Secours Washington Redskin Training Center. But go ahead, Fernando.
Okay, well, the invitation is there. I insist this is an event for everybody. Everybody. is a good gathering. I mean, people can ask questions, kids will have entertainment. And one thing that I would like to say is that this is an event also that is very important to us in terms of fundraising. There is no fee to participate, and those persons who would like to make a contribution, they can do it. They can even put the amount in their registration form that they will be available the day of the event. And I will repeat the email that they can use in order to receive the registration form in advance. The email is fcordero, Cordro, @comcast.net. And as soon as we receive the email, we will send the information to everybody. And I insist, it's a beautiful event. It's not too long. Those that would like to walk, they can walk. Those that they would like to ask questions to the doctors, the nurses, they can feel free and do all of that. So you are most welcome, and hopefully we are going to have a large audience this year. So even if you need additional information, you can go to our website, efba.org.
Fantastic. And Carolyn, what's your takeaway?
Yeah, well, the month of November is Epilepsy Awareness Month, so we're asking the community to wear purple to support individuals that have seizures. And also, again, I work for the company called Cyberonics, who promotes the vagus nerve stimulator. So if any individuals out there are having more than 2 seizures and they're taking more than 2 medications, think about the vagus nerve stimulator, come in, talk to your doctor about it. And also, every month, Cyberonics has a free phone call that you can call in and actually speak to a physician on the telephone to talk about your seizures and different treatment options. The call takes place the first Tuesday of every month at 8 p.m. Eastern Standard Time, and the number is 1-877-451-8943.
Fantastic. And thank you for that information, and thank you for your commitment to the community as well, because I know you take a lot of time outside of what you do, and you're passionate about what you do, so thank you. Dr. Sangha, what do you want folks out there to leave knowing?
I want to emphasize this again, that the treatment of epilepsy has come a long way, and it has changed in a big way. We have much better treatment options and much superior medications available today. So to all patients with epilepsy, go see a specialist and discuss all your treatment options. We can make a difference in your lives. We know that we cannot eliminate epilepsy or cure epilepsy 100% of the time, but we can definitely control the seizures and significantly reduce the number of seizures they are having. And there is all kinds of social, psychological, vocational, occupational support available. So talk to the experts, and this can change your lives.
Fantastic. So again, the November is Epilepsy Awareness Month. I'm wearing purple tonight for that. Thank you, Carolyn, for the reminder today. And the Chesterfield County actually, how long ago was this, Fernando? 2 years ago?
2 years ago.
2 years ago. Chesterfield County actually had a proclamation basically stating that November 13th is Epilepsy Awareness Day in the county. So if you live in Chesterfield, it's coming up. Talk to your employer. If you're a teacher, perhaps add an epilepsy lesson into your lesson plans. If you're a 4th grade teacher, by all means, contact the foundation. There's still time, I believe, to get into the contest.
Yes. Yeah.
A very important thing to teach young people that protecting their brain is important, wearing a helmet. If you want to get in touch with any of us, certainly it's easy to do. You can do that through the Epilepsy Foundation of Virginia. If you need a physician referral, you can call 359-WELL, which is the Bon Secours referral service. The Neuroscience Institute at Bon Secours has basically practices out of all of our Richmond facilities with our physicians, and we have a lot to offer. The website is for Bon Secours Richmond is www.bonsecours.com, and you can go to the physician referral site. Again, the walk this weekend is really to promote and celebrate fellowship and just learn about each other, learn about epilepsy, learn about our helmet, come out, meet a retired football great, and have some food with us. 1 to 3 p.m., Bon Secours, Washington Redskins Training Center, right behind the Science Museum on Lee Street. And we hope to see you there with everybody you can fit into the car. And that's really all we have for you this evening. I do appreciate you sticking with me as your fill-in host. Pat Lane, as you know, does a great job. She will be back next week, and we hope to see you then. So thank you very much. Dr. Sangha, thank you. I appreciate it.
Thank you. It was great to be here.
And you have appointments open for patients if they need that?
We have appointments readily available, and we can see them very quickly. And just give us a call, and we'll accommodate you.
Great. All right, great. And
Okay,
Carolyn,
thank you.
you're available for education
Yes.
at the foundation as always. All right. So thank you. Everybody have a good night, and we will see you next week.
Thank you.
Thank you.
Yep. So,
Thank you.